Hello, this is Dr. David Greene, CEO of the Nevada Pain Network. The topic today is the top 10 ways to avoid the need for a joint replacement. Over 1 million joint replacements are performed every year in the U.S., with hospital stays usually being between 2 and 4 days. With knees, the average age is 70 years, with 60% being women. The infection rate is 1 to 2%. There's a small risk of blood clots. They have a very high satisfaction rates of 90%, with 85% of artificial knees still working after 20 years. Joint replacement is a quality of life procedure. No one has to have one. It's not an absolute medical necessity. Because the implants do not last forever, it's advisable to wait as long as possible to undergo a joint replacement. The implants are made of titanium, cobalt chrome, stainless steel, ceramic material, possibly, and then polyethylene, which is the plastic liner, in this case the socket. So treatment option number 1 for avoiding a joint replacement is activity avoidance. If it hurts, don't do it, or do it less. If you're used to jogging multiple times per week, some of that time do cross training, maybe do swimming or cycling. Or if you're playing golf 5-6 days a week and you have a lot of pain afterwards, cut it back a bit to 3 to 4 times a week. The second option is over-the-counter medications such as anti-inflammatories, ibuprofen, diclofenac, naproxen. You can get those at your local drugstore, or Tylenol. There's also medications called glucosamine and chondroitin, which are available at any health food store or even Walmart. And they have been shown in some studies to help preserve the cartilage that you have and also make some more. There are some very large studies ongoing right now looking at these, they call them nutraceuticals, and to see if there really is a benefit. But they're not very expensive, there's really no risk involved with taking them, and they may provide some benefit. Then we move on to prescription medications, which may include topical pain creams. Those can be excellent for arthritis treatment. High-dose nonsteroidal anti-inflammatories, same ones you can get over the counter, but the doctor writes a prescription, you can get a higher dose. Celebrex is a prescription medication that can work very well. It's called a COX-2 inhibitor. For those who have GI or kidney issues, these can be great. And then short-term opiates. You don't want to give long-term opiates for pain relief, but short-term for exacerbations can be helpful. Option 4 are TENS units. These are battery-powered devices about the size of an iPod. They provide low-dose electrical stimulation through these electrodes, and they have little foam pads on the end. They can change the way the brain perceives pain signals. Option 5 involves weight loss. Less stress on the joint means less potential damage to weight-bearing joints. And if you lose weight with exercise, it also may strengthen up the muscles around the arthritic joints, lessening pain that way as well. Physical therapy can do exactly what I just said, strengthen muscles around the joints and take pressure off of the joint. Also with ultrasound and electrical stimulation, that can provide benefit. Stretching is absolutely crucial to a physical therapy program. Multiple studies have shown acupuncture to be very good for arthritic pain relief. Pretty much every study I've seen on acupuncture shows excellent benefit for all joints with arthritis. Steroid injections have been a mainstay of arthritis treatment for decades. It's actually never been truly proven that steroids damage joint cartilage. The only time that was seen was actually in a small animal study. When they looked at it with large animals, they didn't see it, and in humans it actually hasn't been proven. Usually every 3 months or so you can give a steroid injection. They don't alter the disease, they just put a big band-aid over the pain. But they are excellent, 75-80% at providing pain relief. Option 9 involves hyaluronic acid injections. We all have hyaluronic acid normally in our joints. That's the motor oil of your extremity joints. The one that's injected is made from rooster combs, and its trade name is Synvisc or Hyalgan. And the theory is that it provides hyaluronic acid for pain relief and can help promote formation of new cartilage. Studies have shown that there's over a 65% good to excellent pain relief results between 6 and 12 months. And treatment option number 10 is regenerative medicine injections. This can be platelet-rich plasma therapy, which is PRP, stem cell injections, which are either bone marrow or fat-derived, and the latest and greatest is amniotic-derived stem cell injections, which are great. They have a ton of stem cells in them. So the results of those in small studies have been excellent for both PRP therapy and stem cell injections. They can help delay or avoid the need for joint replacement altogether. So most patients are able to delay or avoid the need for joint replacement. While most joint replacements end up fine, there's always a chance of complications, and it is a quality of life procedure. You don't have to have it done. Arthritis never killed anybody. So, for instance, knee injections have over a 75% good to excellent results with steroid or the regenerative medicine injections. The top pain management clinics in the greater Las Vegas area are Nevada Pain. They offer comprehensive pain management at several locations that accept over 50 insurances with the board-certified pain doctors. The number to call for treatment is 702-323-0553 and visit us online at nevadapainnetwork.com. I'm Dr. David Greene with the network. Your pain stops here.